Diabetes is a disease that can affect a whole family. Support and understanding can make a big difference when figuring out how to live with diabetes. Rod Starns takes a look at the issue in today's cover story.
One of the jobs that clinical dietitian Wilmetta Neely has at Baptist Memorial Hospital DeSoto is to give people advice on things that can help them manage their diabetes. Diabetes occurs when the body doesn't process blood sugar, called glucose, very well. Insulin is what the body creates to manage glucose. Without it, glucose can get out of control, and it's a problem medical professionals are seeing more often.
We're seeing diabetes being diagnosed a lot more often in a lot younger people as well.
Diabetes can be serious. It's a major cause of blindness. It can also lead to heart disease or stroke, cause nerve damage serious enough to lead to amputation, and cause severe kidney problems. There are several types of diabetes. Type 1 is when the body does not create insulin at all. It usually happens to people when they're younger, and they have to replace insulin using shots, pumps, or pills. Type 2 is the type of diabetes most sufferers have. That's when the body doesn't make enough insulin or use it effectively. And some women face a risk of gestational diabetes when they're pregnant. A major part of having diabetes is knowing how to manage the problem. It was something Darryl Green had to learn. The local news anchor first suffered the effects of type 1 diabetes nearly 20 years ago, a couple of years after he finished college.
I was working, and I was working a lot, and we were already getting into the heat of the year, but I found myself, I was thirsty all the time, and I knew nothing of diabetes. I felt horrible, so just one day out of the blue, I said, something's out of sync, and I went to the doctor. And it took him about 30 seconds to look me in the eye and say, Mr. Green, your blood sugar is 694. You're diabetic.
A normal blood sugar level is around 100 before eating. The thirst and fatigue Green suffered were typical symptoms. He now wears a small device that pumps insulin into his body. Green's new life as a type 1 diabetic meant many new rules. He has strict guidelines about what and how much he eats.
It was nothing for me to have dessert anytime that I wanted to eat, anything that I wanted to at any point. And now all of a sudden I have to eat measured doses. I'm not just counting calories, but I'm counting carbohydrates, I'm counting fiber, I'm counting fat, because all of this has a relationship with how your body processes and uses sugar.
There are more than 25 million Americans living with diabetes, but as many as 7 million of them are undiagnosed. They don't even know they've got a problem. And millions more are at risk of developing the disease. Those risks include being Asian, Pacific Islander, Hispanic, African American, or Native American, as well as having high blood pressure or cholesterol, or being overweight.
If you have a family history of diabetes, then that puts you at greater risk for developing diabetes yourself. If you're over 40 years old, you're at a greater risk. And if you're underactive, actually that's the last risk factor.
But with medication, proper diet, and daily physical activity, it's possible for many of the people with diabetes to effectively control the disease and avoid serious problems. For Smart Medicine, I'm Rod Starns.